Hi, welcome to week 8 of Healthcare Delivery Systems. Today we're going to talk about the health professions and the people who work in healthcare. And we're actually going to spend the next 2 weeks on this. The learning objectives are listed here, and we will cover all of these. First off, you need to know some of the terminology that we use for a health professional and a patient. So a health profession is all those professions that provide care to the sick and injured, and that includes any profession that provides pre-hospital care, hospital care, outpatient care, home care, and extended care. A patient is anyone who seeks medical services. Now, last week, remember, we talked about in long-term care, they're called a resident. That's what they're called, but technically, they're still a patient. A clinician is anyone qualified in a clinical practice or medicine, psychiatry, or psychology, as distinguished from one specializing in lab or research techniques or in theory. Here you have the definition of a disease, and that's pretty understandable. But a syndrome is a combination of symptoms and findings that can't be easily identified to a specific cause. So, for example, carpal tunnel syndrome is a pain, burning, and numbness of the hand, but to attribute it to a specific cause is not that easily identifiable. That's why it's called a syndrome. Education, those are the lecture and learning activities, including simulation and patient contact that we use to train the healthcare workforce. And depending on the profession in which you get your training, you can be called an associate degree, a bachelor's, master's degree, or doctoral degree. So for example, you are in an associate degree program, and when you are done, you will be certified. So that's dependent on your profession. Training, there's often a supervised clinical practice, and you have increasing responsibility over time. So part of the certification is that you have some kind of clinical practice. So certification has several meanings. It can be a 1-year or a 2-year program, like medical assisting can be a 1 or 2 year program. HIT, which you are in, is a 2-year program. There's no way it can be a 1-year program and meet the accreditation requirements. Usually with certification, there's a national health profession organization that requires you complete an accredited program and an exam. So whether you're enrolled in HIT or in RadTech or respiratory therapy or occupational therapy aid or physical therapy aid, those professions are usually 2-year degrees, and you have to complete an exam at the end of your program. A physician, on the other hand, is board certified, and they complete an approved residency or a fellowship, and then they have to complete an exam to become licensed. So states use certification as a mechanism in order for you to practice in the clinical setting. Now, the HIT is a little bit different because there is no law requiring that once you finish this degree that you become certified. The reason you become certified is for the recognition of the work and the skill and the effort and training that you have participated in. So in a physician, if you wanted to be a doctor, and we're going to talk about doctors at this point. First you go to college, then you go to medical school. And then your training, you have a residency that you need to complete. And if you want to specialize, you can do a fellowship. A physician, to be certified, you have to complete an approved residency or fellowship program. You have to be licensed in the state in which you want to practice. And you must complete a written or practical exam in that medical specialty. And then you have to maintain that certification. In other words, you have to do your continuing education units. In a licensure, you're licensed in your state, and some states have an agreement called reciprocity, which means, like, say, if you're licensed in Iowa, you can practice in this state. You don't have to get a separate license in that state. Not all states have reciprocity agreements. Primary care specialties, which we talked a little bit earlier in this course. Remember, primary care is a physician shortage area currently. But when you are a primary care physician, that means you practice in family medicine, internal medicine. You might have pediatrics, obstetrics, but primary care delivered by default is emergency medicine. But a primary care, generally, they're called a generalist. So common internal medicine specialties and subspecialties, if you want to go beyond primary care as a physician, you can specialize in cardiovascular or endocrinology or diabetes or gastroenterology, hematology, and oncology. All of those on those lists are specialties and subspecialties that you can participate in. If you want to specialize in surgery, cardiovascular surgery, colon and rectal surgery, neurosurgery, orthopedic surgery, and so forth. Usually, if you want to be a surgeon, if you're a physician, you need continued specialized training. Other specialties as a physician, a radiologist. So a radiologist on the physician level, they do diagnostic radiology, neuroradiology, interventional radiology, pediatric radiation oncology, and nuclear radiology. So depending on what they want to specialize in, those are the different areas that they can go into. Most people don't think that a radiologist is a physician, but they truly are. You can be a pathologist. A pathologist is also a physician level. Pathologists can work with blood banking, transfusion, but mostly they work in cytopathology or forensic pathology. So they look at cells to see if there is a presence of disease or absence of disease. Non-clinical roles of physicians. Physicians, if they don't want to practice medicine, they can be work in administration. They can be teaching physicians in a teaching hospital. They can be research. They can work in public health. They can work in biomedical informatics, or they can also be publishers. So I've met physicians, for example, who are at the end of the spectrum of their life cycle as a physician, and they actually do lectures, and they tour and they give lectures on a specific topic, and they're considered experts in their field. So, health professionals, the people in summary of lecture in A, that was for the role of the physicians. And that's the part of that one.